Good afternoon, students. Welcome to Game for Students 7. Game means gross and microscopy explained. The topic for the day is basal cell carcinoma. It is a university short note in pathology and surgery, can be a short case, a spotter again in surgery, but an important slide and an MCQ in path. So two subjects are being covered repeatedly down the decades. And I hope you see our visitor over here, a rodent, and then it burrows inside, and that is its abode or home. And such is the behavior of the basal cell carcinoma, hence it is called a rodent ulcer. In fact, in the surgery questions, a rodent ulcer can be the wordings. It is a small lesion measuring about 1 centimeter, maybe a little more. It is solitary and it arises from the margins of the lips and it can extend up to the outer angle of the eye. It is a small button-like elevation as we shall see over here. So this is the lesion and this is the surrounding normal skin. In due course, there can be an ulceration and you find that it can be covered with necrotic debris. This is the floor of the ulcer covered with necrotic debris and hence the name rodent ulcer. It is locally invasive, but there is no distant metastasis because you find that there is a surrounding fibrosis which prevents metastasis and the treatment is excision. What are the causes for the basal cell carcinoma? It can be ultraviolet light, a congenital condition called xeroderma pigmentosum where there is a defect in the chromosome. The patient can be having multiple malignancies including a basal cell carcinoma. And it is common in countries such as Australia where there is a direct sunlight. And what is the distribution? I hope you people will remember this hat. The distribution, as I mentioned earlier, it will be from the outer angle of the lip up to the ear lobule and just beneath the forehead. Now, this is the normal skin that we are seeing, and forget the other things. This is the basal layer. It is presumed to be arising from the basal layer and hence it is called basal cell carcinoma. The various other layers of the epidermis are given for completion. So this is the normal epidermis that we are seeing and it is the tumor, and I hope that you people can appreciate the parallel arrangement of the nuclei over here. This is called the peripheral palisading. A peripheral palisading means parallel location. This again is a picture of a basal cell carcinoma. This is a normal epidermis and here I find a tumor and after some space I find another lesion. They are all superficially located and hence it is called a superficial multicentric basal cell carcinoma because it is occurring in multiple centers and it is superficial in the skin. This is an important diagram which I would like you people to describe as well as draw. So look at this one. A normal epidermis is there. This is a keratin layer of the epidermis and this is the tumor. And in the tumor, The classical one will be the parallel arrangement of the peripheral nuclei. This is called palisading arrangement or a picket fence appearance. And coming to the cells, what I am seeing as blue are all the nuclei. They are all small, uniform, hyperchromatic, and the distance between the nuclei is supposed to be the cytoplasm. So this is a nucleus and another one. In between is the cytoplasm. There is no clear-cut cell membrane. The cytoplasm is amphophilic. That is, it is neither basophilic nor eosinophilic. And the cells in toto mimic the basal layer of the epidermis. This is a beautiful picture. In fact, this I would like you people to draw in your records. Taken from Wikipedia. Thanks. So these are the tumor cells. As I told you, they are all uniform. The dark ones are the nuclei. And the peripheral zone, I find that the cells are being, rather the nuclei are being parallelly arranged. And in between there is a normal or unaffected stroma. This is another island of tumor cell. The tumor cells can be seen in the form of sheets or islands or trabeculae. And this is exactly what I meant by the picket fence. I find that the fence, it is made up of multiple chips of wood which are parallelly arranged and they are nailed at the bottom. So this is, in fact, along the railway station and other places, you people will be seeing this classical age-old picket fence appearance. Coming back to the original slide, I find the description will be like this. The tumor cells are small and uniform. They resemble the stratum basale or the basal layer. The nuclei are dark and hyperchromatic, increased intensity of color. There is a palisading peripheral nuclei and mitosis can be seen. Sometimes there can be a squamous component also, in which case it is called a basisquamous carcinoma. Both basal as well as squamous are seen. There are a lot of histological variants of this. And coming back to the story of the hat, you find the gentleman is wearing a hat and it protects him up to the upper part of the forehead. But below that there is an exposure to the sunlight, and this zone from the margin of the lip to the hepatic lobule, you find that there is a direct exposure to the sunlight and there is a increased precedence for basal cell carcinoma. And of course, he is a guest of the day. I hope you people can identify the country. There are multiple groups of these tumor cells, peripheral palisading, and an unaffected stroma. There are different variants of the basal cell carcinoma. Sometimes there can be a melanin pigment, which is called a pigmented variation of a basal cell carcinoma. See you in game 8.